Welcome to the Autism Learning Materials Hub, a collaborative initiative founded by NBAI, AI for Autism, Job for Autism, and Mr. Lam Lay Duong. This platform is dedicated to providing accessible, evidence-based resources for families, educators, and therapists supporting individuals on the autism spectrum. Lesson 2. The source evaluates various behavioral interventions for children with autism and developmental disorders, comparing applied behavioral analysis, ABA, with other therapies like cognitive behavioral therapy, CBT, speech and language therapy, occupational therapy, OT, floor time, and social skills training. It highlights ABA as the gold standard due to its scientific validation, structured approach, and individualized treatment plans. However, the article acknowledges the merits of other therapies for specific needs, such as CBT for emotional issues or speech therapy for communication deficits. Ultimately, the text suggests that a comprehensive, individualized treatment plan often involves a combination of therapies, with ABA potentially serving as a foundational element.
Case study: Leo's journey to communication. Client: Leo, a 4-year-old boy diagnosed with autism spectrum disorder. Presenting concerns: initial assessment. Communication: Leo was nonverbal, using gestures like pulling adults' hands to indicate needs, e.g., wanting food or a toy. He rarely made eye contact when spoken to. He did not point to desired items or respond to his name consistently. Behavioral challenges: frequent tantrums, screaming, falling to the floor when he couldn't get what he wanted or during transitions between activities. Self-stimulatory behaviors included hand flapping and spinning in circles, especially when overwhelmed.
Social interaction: limited interest in interacting with peers or adults. Did not engage in reciprocal play. Self-care: required full assistance with dressing and toileting. Learning style: preferred solitary play with cars and trains. Showed strong visual processing skills.
Assessment tools used: Verbal Behavior Milestones Assessment and Placement Program, VBMAPP, Functional Behavior Assessment, FBA, for challenging behaviors, parent interviews and direct observation.
Intervention goals: based on VB-MAP and FBA. Establish functional communication. Initiate requests for preferred items using PECs. Identify 50 common objects or pictures receptively. Engage in 5 instances of shared attention or joint attention. For example, pointing to something and looking back at the adult.
Reduce challenging behaviors. Decrease frequency and duration of tantrums by 50% within 3 months. Replace pulling hand with an appropriate communication method for 80% of requests. Increase social engagement. Engage in 2-step turn-taking activities with an adult, such as rolling a ball back and forth. Maintain eye contact for 3 seconds when name is called.
Intervention strategies: ABA principles applied. Therapy setting: 15 hours per week of intensive one-to-one ABA therapy at home and in a clinic setting. Communication training: PACS implementation in phase 1 and 2 initially. Leo was taught to exchange a picture of a desired item, for example, a cracker or car, for the actual item. Therapists used highly preferred items, identified through a preference assessment, and immediate reinforcement. Prompts were faded quickly from physical guidance to gestural prompts.
DTT for receptive ID. Flashcards of common objects were presented. Touch, object name. When Leo touched correctly, he received immediate praise and a small preferred reinforcer. Incorrect responses were gently corrected and the trial was repeated. Joint attention. During play, therapists would frequently point to interesting toys or actions and call Leo's name, then reinforce him with praise or tickles when he looked at their face.
Thank you for watching. Subscribe for next videos.